Knock, knock. Hi, Mia. I'm Catherine. I'm going to be your nurse today. Before we start the procedures, I'm going to perform hand hygiene, and I'm also going to provide privacy. Before we got into the room, I made sure to check that the orders had trach suctioning and trach care for this patient. We also collected vital signs to check her oxygen saturation and heart rate baselines. I checked for allergies and any medications that were needed right now for either of these procedures. And we're gonna get started. Hi Mia, so today I'm here to help perform trach suctioning and then also a tracheostomy dressing change and care. That basically is just me cleaning up the area around your tracheostomy and getting rid of your old dressing and tie, and then suctioning is just going to be me suctioning your tracheostomy, getting some of those secretions out to help you breathe a little better. Do you have any questions about the procedure today? No? Okay, perfect. Can I have your name and date of birth, please?
Check if everything is correct on the order.
Perfect.
And then I'm going
Sweet.
to
So before we get started, I'm going to put this over here.
enter the room.
I'm also going to place a towel underneath the patient and raise the bed to a comfortable working height.
Can you state your full name and date of birth, please?
I'm also going to place the pulse oximeter on your finger, Mia, if that is all right, so we can watch your oxygen saturation as we go through the procedure. Okay, perfect. So now we're monitoring your oxygen saturation, and I'm going to place this towel just underneath
Before I already check the chart for any allergies, I don't see any.
your oxygen
I'm just
mask,
gonna raise the bed to like good working level.
so that we can get any of those extra secretions if they do end up
I'm
over
going
here.
to perform some hand hygiene.
Perfect. Okay, before we get started, I'm going to test the suctioning to make sure that it works, and that I'm going to also set it to 80 to 120.
While I'm performing this
Perfect, it looks like it
procedure,
works.
I have to have you wear
And
a mask.
suctioning
And
is
this
good.
is just for
We hyperoxygenated the patient as well before we started the procedure.
the central line.
I'm gonna check the
makes you
area.
vulnerable. And I'm also going to make sure
I just got a respiratory assessment done, and we auscultated her lungs. Again, she looks like she's okay for both of the pieces of care I'm going to provide.
Put on some clean gloves.
So
we're going to take off the old
I'm going to
dressing.
put on some clean gloves and just take a look around the site real quick.
So I'm going to remove the
Mia, if you
old
have any
dressing while
questions,
securing the central line of the
you're
process.
welcome to answer them or ask them
Seal
now.
the corners.
You don't? Okay, perfect. So,
For the purpose of
looking,
this video, I'm
site
going
looks
to
good, hyperoxygenated. I'm gonna move
dressing,
this just off to the
stuck
side.
on pretty well.
Good.
Gonna throw
Okay,
inspect the
perfect.
dressing and then throw it away.
So the site looks good.
I'm going to assess the site.
Before we start, I'm also going to check for any airway obstructions. Can I have you open up your mouth, Mia?
To then
Perfect.
measure
Good.
the
And it doesn't look like there's any signs of hypoxemia.
to just make sure there's no migration.
Good on that as well. Okay, so I'm going to perform hand hygiene again.
The correct measurement. And then I'm going to check for patency of the lines. I'm going to make sure they're locked. If they're unlocked, then I'm going to check for patency. And if the lines are not patent, then I may have to call the provider to heparinize the line. Going to now remove my clean gloves, and now I'm going to do the dressing change.
Put 100 milliliters of normal saline in this basin right here. Okay, so we've already done that. Okay. Oh, it looks like they're actually on this side.
I'm going to set my sterile heel, shine side down. put on my sterile gloves.
Make sure to only touch the outside to keep them sterile. It looks like it closed in on these, so I'm going to just put it back up. Take this guy out.
I'm gonna set up my equipment.
And this is my tracheostomy tube. Oh, sorry, tracheostomy suctioning tube. Alright, so for the procedure, I'm going to leave my dominant hand sterile and my non-dominant hand clean.
Okay, so I'm going to take the President
I'm going to connect this to
clean the site,
my
going
suctioner.
back and forth with
Oopsies.
circular motion around from ear to outer. I'm going to stabilize the central line, and I'm going to do this for at least 30 seconds.
Okay, and we're going to intermittently suction. Before I start, I'm going to test to see if the suctioning works.
Next, I'm going to use the alcohol swab.
And it looks like it does.
I'm going to let it dry.
Okay.
Completely. I'm going to use the alcohol swab, and I'm going to swab.
Alright, Mia, I'm going to place this down the tracheostomy tube.
One
Suctioning will last about 10 to 15 seconds. Okay, we're going to twist it down until we hit
now I'm
resistance.
going to put the
And then we're going to pull back an
transparent
inch.
dressing on. I'm going to make sure that everything's dry before I do this.
And then as I pull out, I'm going to also twist and intermittently suction.
And then make sure there's no air bubbles. For the purpose of this video, I'm not going
Watching
to directly
her
put this
oxygen
on the
stats as I do it.
but,
And it looks like she was able to tolerate it well, and her oxygen saturation is back
put it
up.
down, make
So
sure
we
there's
don't
no
have to
air
continue to
bubbles,
suction.
and then I'm
But we
going
could
to
have continued to
remove
suction
the
up to
label
3
and put it
times
right next to
for
the
10 to
vaccine,
15
and I'm
seconds
going
each
to
time.
initial and date when I put the new
For now, I'm going to
We're all done. Clean
take
up.
this out right here, and I'm going to clean up my workstation.
I'm going to perform some hand hygiene, and then I'm going to document.
And then all of this is also going to be
I'm going to
thrown away,
date
and I'm going to get
time
ready
when I
for
put
the
new
second part of the
dressing. I'm also
procedure.
going to document any assessments of the
Okay, so
site.
I'm going to perform hand
during the
hygiene.
dressing change and any signs of infection.
All right, Miss Mia. Again, we're going to make sure to hyperoxygenate her and watch her oxygen stats as we go. Her pulse oximeter is still on. Respiratory assessment has been completed, and her baseline vitals have already been put into her chart. We're good. She's at a comfortable working height. Get this first section. Mia, I'm going to do some trach care right now. Okay, I'm going to do that cleaning that I mentioned and then the dressing change. Do you have any questions? No? Okay, perfect. Alrighty. Again, hyperoxygenate, so we're going to move her out of the way. Before I start, I'm going to put on a pair of clean gloves. And I'm just going to check the site and then also remove the old dressing before I start the sterile procedure part. Okay. Alright, Mia. So I'm going to remove this dressing. I'm also going to note any drainage on the dressing, future note, and put that in her patient chart. I'm looking around the edges of her tracheostomy, and it does not look like there is any redness or swelling, inflammation, or odd odor. It doesn't look like there's any signs of infection or irritation around her trach site. So that's good. Take these off, perform hand hygiene. Okay, so I'm going to open this up. shiny side down. And then I'm gonna put the gloves out here. And then I'm going to dump the contents of this out. I'm going to pour normal saline solution into both of these containers, one for rinsing and one for washing. Making sure to maintain sterile field here. Alrighty. I'm going to open these back up. Pinch them. I'm going to put on the sterile gloves and make sure to leave the gloves sterile.
That's like in a video when you're
And then these ones on by scooping. Okay, and adjusting these ones as well. I'm just going to organize my sterile field a little better. I'm going to put a 4x4 gauze inside of the normal saline and let that soak. And then I'm also going to soak the Q-tips in saline solution.
Do you like to put the mask back on after I do my suctioning?
Okay, perfect. All right, so this, again, in this procedure, my non-dominant hand is going to become clean and my dominant hand will be sterile. I'm going to pop out the tube right inside of here, okay? All right, we're going to be gentle to pull the rest of it out. There we go, okay. I'm going to, still sterile, I'm going to take this guy, squeeze it out, move it over, and then place this inside of this sterile normal saline water. And then I'm going to dry tube of this, and this goes in the trash. And then I'm going to dry it with these pipe cleaners. Get the other side as well. Good. All right, and then I'm going to pop this back inside gently. Alrighty. Okay, I'm going to take each of the Q-tips and swab the outer edge of the tube, moving outwards.
Yeah, you said before you did the procedure, you're gonna hyperoxygenate the patient.
It's fine.
Moving from the inside out. to use the 4x4 gauze with normal saline on it to just wipe the area again around the tracheostomy site. Throw that away. Grab the dry dressing. Dry off the area. Throw that away. And then apply the new clean dressing. Okay, and now both of my hands are clean. I'm just gonna move this towel down ever so slightly. Okay, so that's ready to be taken off. And then this tie, I'm gonna loop in on this side. So I'm going to place the new tie before I take off the old tie and make sure that it's laying flat. Mia, could I have you lift up your head for me, please? Thank you. So I'm just going to place it behind her head, making sure that it lays flat against her neck. Perfect. Then we're going to tie it over here. Making a square knot. And then removing the old dressing finally. Perfect. Now the procedure is done. I'm going to clean up my supplies. I'm also going to replace her oxygen mask. I'm going to take the towel out from underneath her. And again, her oxygen saturation did well during the whole procedure. I'm going to put this away and throw away all of these supplies. Take off my gloves, throw those away, perform hand hygiene. I'm gonna lower her bed, make sure her call light is within reach. Mia, can you reach your call light? Perfect. Make sure her bed is locked and low. And did you need help with anything before I head out? Okay, good. So I'll make sure to document the site around the tracheostomy, how well she tolerated it, and any of the drainage that was left on the dressing. And that's it.